Distinguished faculties in home and abroad, and learned audience. I am Dr. Gobinda Associate Professor and Head of the Department, Mymensingh Medical College. I'd like to talk about multi-center or multi-country study. The title is Demographic, Clinical Characteristic and Medication of Re-hospitalized Patients for Acute Coronary Syndrome. It's a boomerang study. I am one of the co-author from Bangladesh, just a representation in our department, Mymensingh Medical College. Introduction. Coronary artery disease is the leading cause of death worldwide. Ischemic heart disease now accounts for almost 1.8 million annual death, or 20% of all death in Europe, even with large variation between countries. Rehospitalization for recurrent ACS after an acute MI associated with high mortality rate affect the psychology of the patients negatively, associated with increased financial burden on both patients and healthcare system as well. Although some proportion of the rehospitalized patient after ACS may be preventable by improved pre and post discharge patient care system. While late readmission, that means more than 30 days, have been related to disease-specific risk factors, and early readmission can effectively reflect quality of the care received in hospital. Recent data suggests that rehospitalization with ACS have declined over the last years, but there is a remaining need for potential further reduction of rehospitalization after acute coronary syndrome to determine the most predominant predictors that can guide strategy to reduce rehospitalization's burden. This multi-center study aimed to evaluate the demographic, clinical history, and the medication of rehospitalized patients who suffered a new cardiac event in 12 months after admission due to ACS, that means after index admission. The study includes patients from 15 different countries, including Bangladesh, or Department of Cardiology, Mymensingh Medical College and Hospital. And methodology, patient age more than 18 years who have been hospitalized between 1st November 2017 and 1st April 2018 for ACS within 12 months before the readmission for a new acute coronary event, especially ST-elevated MI and non-ST-elevated MI were enrolled in this study. The protocol was approved by the Institutional Review Board, and SP software version 20.0 was used for statistical analysis, and numerical variable are expressed as mean plus minus standard deviation. And in the density analysis of data, mean, standard deviation, and percentage are used. Differences in categorical variable between groups are tested used in sample t-test and the Mann-Whitney U-test as appropriate. P-value usually less than 0.05 was considered statistically significant. And Pearson correlation analysis was used to evaluate the association between variables. The results. The present study included total 628 patients, around 65% from Turkey, and consecutive patients rehospitalized acute coronary syndrome, that means ST-elevated MI only 23%, and non-ST-elevated MI 76.9% from 15 different countries. And Bangladesh around the second highest position in the sample size or number of patients. Among the patients, the proportion of university graduate was 8%, and 28% of patients had never been to school. The majority of the rehospitalized patients are men, that means 67.9%, and mean age was 63 plus minus 15.53 years. And 64.6% patient had typical chest pain, and 33% patient had atypical chest pain, and only 2% patient had not any chest pain during readmission. 18 patients were readmitted to the hospital with cardiogenic shock. In-hospital mortality was 13 patients, that means 2.07%. And 48.41% were discharged from hospital earlier than 3 days, and 107, that means 17.04% patients stayed more than 7 days. The subcategories of first index diagnosis were 36% STEMI, and 63.8% non-ST elevated acute coronary syndrome. The mean time from index discharge to rehospitalization was 189.2.5 plus minus 118 days. The most common risk factor are diabetes mellitus, and second, hypertension among a rehospitalized patient. And 40.6% of patients are current smoker, and 34% are former smoker, and 48% of patients had dyslipidemic, and 42% of them are doing mild to moderate physical activity. These are the distribution of the risk factor according to the increase, gradually decreasing percentage of the. Unfortunately, 27% of patients stop taking medication before rehospitalization, and they are taking drug, acetylsalicylic acid, clopidogrel, ticagrelor, prasugrel, beta blocker, ACE inhibitor, ARB, statin, warfarin, and direct oral anticoagulant in different percentage proportion of patients. The mean left ventricular ejection fraction was 50.64%, and 23% and 26% of patients had heart failure and valvular heart disease respectively, and most patients had normal sinus rhythm and atrial fibrillation, and only one had a pacemaker. The mean heart rate was 80.6 plus minus 13.32 per minute. However, 91% of patients underwent coronary angiogram during rehospitalization, and 17% of them received only medical treatment. And most of patients, that means 69%, had multivessel disease. On the other hand, cardiac Parkinson's coronary intervention were performed in 68% of patients, and 5% of patients who underwent coronary artery bypass surgeries, that means CABS. Fibrinolytic therapy was applied just only 49 patients, that means 7.8% of patients. So discussion in 2012, Sango et al. Analyzed data from, just now we go to conclusion. Conclusion, several factors was found to be responsible for recurrent hospitalization following acute coronary syndrome. Understanding, consideration and efficient management of this factor can prevent rehospitalization of high-risk patients and improve their outcome. Thank you very much. Thank you all. Thank you, everybody.
Thank you, sir, for your wonderful deliberation. Is there any question to the speaker from chairperson and panelist?
Sir.
Very interesting, actually, study. We have a lot of acute coronary syndrome patients. So if we can manage them properly, along with all medications and also PCA or CABG, and also the risk stratification and good follow-up, so we expect that they will not have some recurrent attack, reinfarction, or recurrent MI or something, and should not have recurrent admission, and they should be in the group of CCS, chronic coronary syndrome. So in your boomerang study, you have seen shown that significant number of patients, particularly in Bangladesh, are having hospitalization for second or subsequent attacks. So what are the causes underlying of this rehospitalization? What is the preventive strategy we can adopt for this patient, and whether the initial management has any role in subsequent rehospitalization? Thank you.
Thank you, sir, for a nice question. Actually, we can prevent rehospitalization. The most important things, late hospital readmission, that means more than 30 days, usually disease-specific cause was found here in this research paper. And the early readmission, usually patient when discharged, pre-discharge medication not efficiently given, or counseling, lack of counseling for compliance of the drug. The most two important factors for recurrent hospitalization. And also there is some percentage of the patients stop the drug. Stop the rest because the just taking 1.5 months or 2 months again having the treatment and patient feel better, so stop all the drugs. So that there is a counseling is the most important part. Not only give the drug, also counseling advice, one of the most important part to reduce the recurrent hospitalization of the acute coronary syndrome patient or chronic coronary syndrome patient. Thank you very much.
Thank you, sir. This is the time to hand over the moment to the presenter. I'd like to request the chairperson to come on the dais. And I would like to request first